I'm good. I'm Angelina. I'm Eloise's nurse.
Yeah, I think you were in before.
Yeah, how are you guys doing?
We're doing really good. She still has kind of a little bit of a cough, but
Yeah.
yeah.
She seems to be doing a lot better than when she
Yeah.
first got here.
Yeah.
So I was just talking to the doctor and we're gonna get little Eloise back home. We're getting you guys discharged.
That's good. Yeah, so I just had a couple questions. So before we get discharged home, I don't want to go home not knowing. But she wasn't nursing at home. So I'm just kind of scared if we go back home, and she's still not nursing. Like, I'm not really sure what to do when that happens, so.
Of course, yeah. So nursing takes a lot of, eating in general takes a lot of energy, and it's hard when you are having a hard time breathing like little Eloise was. So she might have a little bit of a hard time with it, but not as hard as before. She's been doing much better since she's been in the hospital, and she's been, nursing well for you for the past, like today, and but if she is having a hard time nursing at home, you can always pump and then try with a bottle. So that should.
Did that have something to do with that thing that they put her in earlier? What was that for? It was really scary looking.
Oh, for the x-ray, yeah.
Oh, okay.
So they have to use that little tube for x-rays to hold the baby still because they can be really squirmy, and just so we can get
Eloise is so squirmy.
Yeah, and we just want to get a proper view of what's going on in there. So they just wanted to see if there was anything that they needed to see in her chest, and then it doesn't hurt them or anything. It's just really awkward.
So will those puffers help with her chest? And like those puffers, I don't really know. We're gonna take her home with those puffers now, like.
Yeah, so we're gonna send her home with one puffer to just take if you think maybe she's having a hard time breathing, and you're not really familiar with them, are you?
No,
right.
I don't. I've never used a puffer before. Like, her dad had asthma when he was little, but he doesn't really remember how to use the puffer. So.
Right. Okay. So we have the puffer itself, and what you do is you're gonna take it and you're gonna shake it.
Okay.
And then you're gonna take the clear tubing that we have. You're gonna attach it to it.
And it has the little.
And it has a little face mask, so you're gonna connect it to that, and we're just gonna put it right over her nose and her mouth there. And once it's covering both her nose and her mouth, you can push the little button, and you're just gonna watch while it's still sealed that she's taking a couple breaths.
Okay, that's not too complicated then.
Yeah, make sure she gets the medicine, and you only have to give one puff.
So is she gonna be on this for a long time, or what's the timeline like?
Yeah, that's a really great question. So there's no guarantee of how long she'll be on it. It's for right now, she's gonna have it for a little bit if she needs it, but it's not gonna be scheduled like it has been in the hospital since she is doing much better, but we do want you guys to have that as a backup option if she starts to not feel good. But also because her dad had asthma and now having this RSV infection, she's at a greater risk of developing asthma. So because of all of these factors, we have referred you guys to the chest clinic at the IWK, and they're going to do a follow-up appointment with you guys, and we already have that scheduled. Yeah, we have an appointment card here for you. So that's some information about the IWK chest clinic there.
Eloise, you okay, honey? Okay.
Yeah.
So I'm really scared that she's gonna get sick again, though. Like, we live in a really like rural area. Like, we don't really have a family doctor right now, with how Nova Scotia is. So.
Right.
I'm scared she's gonna get sick again. So.
Yeah, that's really tough. Myself and the social worker and the resource nurse, we compiled some community resources for you. So when you're at home, since you don't have a family doctor, we do have the option to use Maple, which is a virtual care option. And it's just a website, you sign in, you make an account, and it's accessible 24/7.
That's great.
Yeah, so it's just right from your phone.
Okay.
It's always ideal to see someone face to face, but this is a good alternative when that's not an option. I know sometimes you do have to drive quite a bit to.
Does that cost a lot of money? Like, we don't have insurance right now. So.
Since you don't have a family doctor, it is covered. Yeah.
Okay.
And then another option is the pharmacist. So you can go to the pharmacy and They're able to give you some medications without going through a doctor, depending on what it's for.
Are those medications going to be expensive?
Most of those would just be covered directly through pharmacare.
Oh.
So you would have the coverage for that.
Okay.
We also have a social worker.
Mm-hmm.
So there's social workers in the community.
Mm-hmm.
They can kind of help you check where you're at on the list with getting a family doctor, help connect you with more resources in the community.
That's great.
Yeah, we
Yeah,
also have
definitely.
urgent treatment centers and emergency departments, and if you have questions, 811 is also
perfect.
a number you can call.
Yeah, perfect. Well, thank you very much for all of this. So, be very happy to get little Eloise home, and hopefully she's feeling better soon.
Yeah, do you feel like you feel better about taking her
I
home
do,
now?
yeah. I have all this information, all these resources. So, yeah, thank you so much for putting this together for me.
Yeah, of course.
Mm-hmm.